Born in East London in the Eastern Cape, Dr. Lolwakhe Maqubela has a Bachelor of Medicine and a Bachelor of Surgery from the University of Cape Town. Dr. Maqubela shares that medicine has been unrealistically glamorized, and one of her passions is highlighting the reality, mental health struggles, and adversities that young Black female doctors experience in this field.
Can you still believe it when people call you doctor and you like introduced like that?
Sometimes when people call me doctor, they're normally asking for favors, and it's like, but like when random people call me and they're like, is this Dr. Maqubela? I'm like, what? Oh, yeah, it is me.
Tell me about the time you realized or when you made the decision, but actually,
so I think I chose medicine, I chose actuarial sciences, and I chose civil engineering. Because at that time I was also interested in engineering more than any of the other two. And then I got into medicine first. Actually, that was the first thing that provisionally accepted me. And I was like, oh, I guess I'm going to be a doctor then. And that is how I started the journey. And the thing that when it completely sank in that I wanted to be a doctor was probably halfway through first year when I volunteered at like a rural hospital. And I was like, actually, I want to be a doctor. Like there's things where if you're given the platform to change, then you should change. And I'm like, I'm given the platform, let me try be the change. So yeah.
I love that. Let's talk about that, because you are a doctor who looks a certain way, you know, who sounds a certain way. And so you're going to constantly be kind of, I don't want to say confronted with socioeconomic issues, especially in South Africa. And you mentioned the rural areas. So what are some of the things that you feel like medicine has shown you and that this is a problem and you want to be part of the change? Like practically, what do you mean by that?
I think something medicine has shown me, but more specifically working in public, is that just as a general, health is underfunded. So it would be like, you'd be at the best hospital in the province, but it would be so, there's such little resources that you can't even like show that this is the best hospital in the province. Like there's such little opportunities or little resources to do all these fancy technologies that you see elsewhere. Just working in the public health sector in South Africa just really shows you how under-resourced and understaffed the hospitals are, and how much academia and knowledge and research is put into advancements in medicine that we can't implement in our own system because of the lack of funding.
What are some of the expectations you came into the profession with that you were like, oh, I was disappointed?
Like you come into, well, again, it depends on what you're exposed to, right? So when I initially came into the profession, I studied at UCT, which is like, Cape Town has a lot of resources. We can't like beach on the Cape Town has a lot of resources, a lot of research, a lot of funding. So with them, like to the level you're taught at and what you're exposed to in Cape Town, when you move to different parts of the country, it's very different. So with like the knowledge and like the advanced training we had gotten at UCT, then moving to a different part of the country which doesn't have as much resources, as different protocols due to the resource restraints, it was just, yeah, it is a little discouraging at times. Because you're like, I could be doing so much more for this patient, which could probably help them a lot more than what we're currently doing, but limitations, there are a lot of limitations.
And what about the flip side? What are some of the positive things that you didn't expect that you found in the field?
Things that I've learned is how much knowledge and experience like nurses have. Like other people in health also bring about so much knowledge, and they can have so much influence in the teamwork if people just involve them. Like that was quite nice to see in practice in other places, because you don't always see it.
Yeah.
And therefore, since you're always taught in isolation that as a doctor, you must A, B, C, D, it's nice to know that even though I should do this, there are other people who can also assist or can have input with their knowledge and their expertise. It's nice. And
That's
patients are really nice.
are they?
Patients are really nice sometimes. Like they're just encouraging. They're like, "Oh, young doctor," and they're ready to hear what you have to say, and they tell you everything. Yo, working with people all the time can actually make or break your day, but most of the time, it ends really well.
Are there things that you're seeing as a young Black female doctor and perspectives that you're like, hey, this needs to change?
There's a lot of undermining from colleagues, people in the same level as you, people higher ups, people of different professions who are just like, no, but you're still a child. Like, I don't know how to describe it, man. Just people not thinking that you are capable or knowledgeable of what you know. You have to work super hard to try show people that you can do the bare minimum. And it's like, I could do so much if only you would let me. If only I didn't have to beg for the same opportunities granted to my other colleagues, If you genuinely just be like, do you want to? Then I'd be like, yes, because I can and I've done it before. Whereas now it's like, oh, just a young intern, it's fine. I'll get someone more experienced. And it's like, but had you granted me the opportunity, I'd get the experience and thus be able to do it as the intern.
Sure.
It's quite hard to navigate. And then you do get some disrespect, especially as a Black female, where people are like, I don't know how to describe it, but I don't mind being called sister or like a nurse when I'm walking around. Genuinely, if a patient needs me, then I'll come to them and then I'll try hear out their grievance, then try work from there. But then there's a disrespect of, oh, you don't even know what you're doing, you're just a nurse. And I'm just like, even if I was a nurse, firstly, that is disrespectful. That is disrespectful to say. Secondly, I am a doctor. Therefore, I pretty much am I'm capable and I know what I'm doing. It's quite a weird thing to navigate. That thing of trying to be like, I'm not a sister, not in the sense that they are unaware or they're not good at what they do. But also respect that as a Black female, I can be a doctor.
What is something that you wish someone could have told you before you pursued medicine?
It's hard to answer this question without sounding like I am discouraging people from doing medicine.
Okay.
Like, I feel like medicine is glamorized. Medicine is glamorized. The TV shows, the way people put it on a high pedestal. Nati, I think when we show off sometimes on social media, we glamorize it a lot because I won't lie, there is a lot of glamour. But same coin, there is a lot of, it's exhausting. It is draining in all aspects. Like patient deaths, working the long hours, adverse events, things are just excessively draining. Interdepartmental conflict that you can't really get a part of, but that affects your working day. Like, my advice would be shadow a person of each tier. So shadow an intern and do the full 24-hour call. Like, do the full call, see what it's like to not have slept and needed to work the whole time. Shadow a medical officer. So someone who has already finished internship and now they haven't started specializing yet. So they have very different responsibilities, but they have a lot of responsibilities for where they are on the tier. And then never shadow in private, right? Private, although very nice, and you could get to work there, they work very differently to the hospital system you're going to work in for the 6 years of your degree, and then for the 3 years of internship and ComServe. So private is something you can get exposed to while you're still studying, but to know if you truly want to do it and if you have, I guess, the oomph. Medicine is quite broad. So not everyone who studies medicine has to be a doctor. Like, you could end up working in pathology, you could work in the labs, you could do research, you could end up lecturing, you could work for like insurance and be one of those advisors, or you could actually work in hospitals. Like, medicine is quite broad, but because in order to get to those points, you have to do your degree, you have to do internship, you have to do ComServe. I say get exposure from those times and then see if this is something that you could get used to or something you could push through, I guess.
There's so many doctors that are genuinely depressed and have been talking about the long work hours and the low pay and all of these things. So what do you have to say to that?
Mental health in the medical field is not taken as seriously as it should be. Like you think we would know better, but it's the small things, man. Like the fact that most of us don't get lunch breaks, or the break is allocated, but if you were to take the hour break, then it's like, then I have to work a longer shift, or like I have to work more hours. Whereas if I don't take a break, I can leave by 3:30. But if I take a break, then 5 o'clock is when I'm leaving. You know, it's like how much work is shoved into our day doesn't correlate with us taking as many breaks as you should. Wow. One, and it's quite a hard job. Like, I don't think people understand how taxing it is to have to work 24 hours or 26 to 28 hours, really. The next day you're off, then it's back to work as normal and you're tired and things just aren't going well because there are a lot of factors in healthcare, like availability of resources, patients telling the truth. You think it's such a small thing, but it's really the little things that affect patient outcomes, and taking a lot of blame on yourself, not having the correct support, enough people working for the right support. Again, your colleagues falling sick, loved ones falling sick, like growing up, it's really a lot. And even with like the pay thing for doctors, it's not like we don't get paid a lot of money. Everyone's aware doctors are some of the highest earning people, just as a general, but we don't get paid for all the hours you work. Like we have a standard set overtime that you put on in your contract. That is so much less than the overtime that you actually work. So it's not that we're complaining that we don't get paid enough. We don't get paid for the hours you work. I think that's what our main complaint is, right? So if I had to clock in and clock out like other people clock in and clock out, I would be getting paid so much more money, or I would be getting paid the same amount of money, but working so much less. It's anxiety inducing when you come from a different learning institute, or the province you studied at is very different to how things work in the hospital. Whereas the seniors that are at the hospital expect so much from you that you weren't expected to know the year before. It's like, nothing has changed. I just got a degree. Wow. Like, you're supposed to still training. It's still training. Internship is still training. And I think people forget that. Yes, I am a doctor. Yes, I have now more responsibilities, but now you also have to equip me enough so that when I'm an independent doctor, I can still do what is needed of me from the training I got in internship. This may be a controversial topic, but I also think people in management or higher positions don't know how to deal with people's mental health issues. And it's not necessarily our responsibility to teach them. I think it's a limitation that they should introspectively look into themselves, see what their limitations are, and then learn from it. Like they always say, medicine is lifelong learning, and we have all the tuts and all the lectures just to help revise us all the time, but no one actually takes an initiative to be like, how do I deal when someone below me needs a mental health day, or the interns are suffering in this way? How can I provide support? Like, I can't magically make everything better, but there are ways I can provide support so that they don't feel as overwhelmed, as overburdened as we did when we were interns. We're not expecting you to move mountains. We're not expecting you to cure our depression. But at the same time, don't act like it doesn't exist, or don't act like I'm being dramatic. And I think as a generation, I don't necessarily think we're sensitive or we are whatever. I think we're just more aware of our emotions. And because we have been given the platform or the guidance to be more aware, it's like, how dare you be aware that this makes you sad? Like when I was an intern or when I was a junior, we had it way harder and we weren't allowed to. And it's like, it's sad that you had to go through that. But now that you are in the position to make the change, what change are you bringing?
I want to ask you about general advice that you feel is absolutely paramount that people take from this conversation.
You genuinely are capable. To just anyone now listen, you genuinely are capable. There are mountains that you must climb. And some people get to those mountains with the most sophisticated climbing equipment, and you just have techies. It might be significantly harder for you. And sometimes you might not make it on the first time, the second time, but sometimes most of the time, actually probably all of the time, you are knowledgeable, you are capable. It's just that the factors around you and the factors that influence how you got to where you're going and how you're going to get to where you want to be are very different and will influence your road differently than anyone else. And imposter syndrome, it sucks. It sucks. I think almost everyone has it, where you don't think you're good enough, or you don't think you belong, or other people make you feel like that. Sometimes it's not even a you thing. Other people genuinely make you feel like you don't deserve to be there. That time you've worked your heart out. You've worked your butt off. And you are just going above and beyond just to show that you belong there. Not even to excel. You're not working hard to be the best. You're literally working hard so that people literally recognize you. It's one of the worst things that I think people have to go through. And genuinely, it's something that I think a lot of Black females have to go through. And then, like with the tiers of how people are perceived as professional or high-ranking professionals in this world. So work hard. You've got this. You've got this. You know exactly what you want and where you're going and what your goals are. The roads may not look the same, but honestly, the end goal is there. And medicine is quite hard to get into. I won't lie, medicine is quite hard to get into. But going straight into medicine is not the only route. There are so many other routes. Doing other degrees first, bridging courses. There are so many other routes that from varsity into the 6 years and graduating, that route is rare. And it's painted as common, and everyone's always like, but how are you not finishing in record time? Or you didn't do medicine first. That is not common. And there are a lot of ways to become a doctor. Never let the only way that is shown to you shadow all the other ways that are possible. And something I would like to advise people, which I think is also a bit shaky, but just because you have the marks doesn't always mean you'll have the empathy or the compassion or something to be a good doctor. And that shouldn't discourage you from going into medicine, but just be aware of it. Like, I think some people feel entitled to medicine because they got good marks, but then when it comes to being a doctor and bedside manner and patient compassion, they're lacking. So also now as a person, when you go into medicine, realize that it's not just about the books. It's about the patients. You are there to serve a community. You're not there as a person who got 8 A's in matric. The way when patients come to you, it's like their most vulnerable states. And if you're just going to get there to them like they're just a checklist off the table, then they tend to feel guilty. Some people actually feel guilty for feeling pain. And then they downplay their pain. That time they're in excruciating pain. It's genuinely so bad because they feel like they're inconveniencing the people who are there to help them. So it's small things like that not then affect you and how you treat your patient, but it affects the patient and their outcome.
A little birdie showed me that you just graduated and you were like, I'm gonna just give myself a car because I've been through hell and back. Not a lot of interns can do that and be like, let me just get a nice big ass car because I've been through the most. So your job does come with perks.
No, our job comes with a lot of perks. I won't lie, the money is a very nice perk. And there's some financial security in that people will trust that you'll be able to pay things back. So you get financing is a bit easier to secure. Like that's how I'm able to get my big car 2 months fresh out of varsity,
What?
It doesn't always feel like a job. You do feel it in the morning. And my internship group, honestly, what an amazing group of people. It's like people with just like great humors and who are hardworking were put together into a group, and we work well.
Well, thank you for coming on the show to just tell us what it really is like to be a doctor, the great things, the perks, the finances, the little cute moments, but also the hardships and the mental health struggles and, the underfunding that we're living in South Africa. I feel like you've did it all and we're really grateful for that. And I'm hoping that you guys watching can, just think about decisions and really think about what you want to do and what kind of doctor you want to be. Because one thing you said, friend, and I resonated with that so much, is that, and I've seen this in public hospitals, people will really be feeling apologetic about being there. And the treatment is really so bad.
And it's small things, man. Like someone would come in with a pain somewhere. Because they feel like their pain isn't significant, they forget to mention that rash. And that rash changes everything. You know, like mention all the little things. Yes, for you or even to us, it may be like, ah, that's not important, but at least you mentioned it. You can say, I did say to my doctor about that weird rash that happened after I ate that, whatever. Then I could be like, could that be an allergic reaction? Could that just be a random rash that happened by chance? Like small things.
Okay, guys, we have come to the end of the conversation. We hope you enjoyed it. From me, Nolali, and Dr. Lolwakhe Maqubela. I will see you guys later. Bye.
Bye.